Welcome to Fast and Furious MCQ edition. Let's learn about the physiology of nerve injuries. The physiology of nerve injuries can be classified based on the Seddon's classification and Sunderland's classification. In Seddon's classification, we have three types, that is neuropraxia, axonotmesis, and neurotomesis. In case of Sunderland classification, the neuropraxia stands for 1 and axonotmesis is 2 and neurotomesis is the 5. In between, we have 3 and 4. That is the difference between the Seddon's classification and Sunderland's classification. Let's see each of this. The neuropraxia, it is the most common type of nerve injury and it is a reversible nerve injury, and the physiologically it returns to its normal. It most commonly caused due to the mechanism of persistent pressure. The example of this neuropraxia are Saturday night palsy or weekend palsy or crutch palsy. In this condition, the drunken male used to sleep with the axilla stretched or continuous pressure over the chair, and in the daytime when he wakes up, he present with the numbness of the arms and forearm, and that is called the neuropraxia. It is a reversible condition. And that stands for the Sunderland's type 1 nerve injury. In case of axonotmesis, that is Sunderland's type 2, the axon gets terminated. Here axon and T stands for termination. Axon get terminated, but there will be an intact epineurium, endoneurium and perineurium. Here the green innermost is the endoneurium, and outside the endoneurium we have perineurium, and outside the perineurium we have epineurium. The epineurium is the outermost. That is the axonotmesis. This axonotmesis may be according to Sunderland's classification, axonotmesis type 2 is presented with the axonal discontinuation. Only there is a discontinuation in between the axons with intact endoneurium, perineurium and epineurium. And in case of Sunderland type 3 classification of nerve injury, along with the axonal discontinuation, the endoneurium layer is also affected, and that is the type 3. In case of type 4 Sunderland classification, along with the axonal discontinuation, the two layers from it, that is perineurium and endoneurium, is also affected in case of type 4 Sunderland classification. In case of type 5 Sunderland classification, it is also called as Seddon's classification as neurotomesis. There is termination of neuron. Neurotomesis stands for termination of neuron. There is a complete termination and there is no connection between the two ends, is called the neurotomesis, and it is an irreversible stage of nerve injury. Here the complete discontinuation between the nerve ends. So we have the block over axon, epineurium, endoneurium and perineurium completely terminated, and that is the neurotomesis or Sunderland type 5 classification. In case of neurotomesis, as a healing process, the ends of neuron gives rise to a smooth fibrous tissue that is called the neuroma from one end. From the neuroma, there will be sproutings of axon will be there as a healing process. In case of axonotmesis, this healing process continues and it forms a connection between the two ends. But in case of neurotomesis, it will not form the connection between the two ends. They are completely terminated. That is called the neurotomesis or Sunderland type 5 nerve injury, irreversible nerve injury. There is a sign to elicit the healing process in case of neurotomesis, that is Tinel sign. In Tinel sign, we used to percuss the nerve which got injured, and the point where the tingling sensation is felt, that is the point where the new axonal sprouts have origined, and that sign is called the Tinel sign, and it helps to diagnose the regeneration of nerves.